Let's go ahead and get right to it, beginning with gang prevention. Sean Boyle has worked at the Children's Services Council in St. Lucie County since 1997. He currently serves as the executive director, a role that he has held since 2009. In his role, Sean has worked with residents, churches, and local nonprofits in the community to design and fund effective children and youth programs for more than 20 years now. Additionally, Sean has advocated for state policy changes that resulted in easier access to health insurance and children and strengthening the juvenile justice system. He is active with many local agencies in his community and is also a radio host and local basketball legend. Teresa Bishop serves as the executive director for the Roundtable of St. Lucie County, a 501c organization, and works closely with the executive level leaders to accomplish system change that results in improved outcomes for youth. She is also the founder and director of Provision Training and Consulting LLC. Over the past 25 years, she has worked both nationally and abroad to improve capacity of communities, federal and state agencies, as well as community and faith-based programs to achieve positive outcomes. She has focused her efforts in the children and family arena, and in recent years has championed causes around community development, youth development, and juvenile justice issues. Let's welcome Sean Boyle and Teresa Bishop.
Thank you. I'm Sean, and I'm going to start. And I just got to clarify, when I said send my bio, I did not say I was a basketball legend, but I appreciate that. I'm going to take that with me. I said that I play basketball, but not a legend. Let me get started. As you mentioned, I'm the executive director of the Children's Services Council here in St. Lucie County, and I'm excited. And quite frankly, I asked if I could just do a small introduction because we help fund a project that you're going to learn about, and we're excited to share one of our successes. Before I do, for a little context, as a funder, and quite frankly, we are the largest solely child-focused funder in our community. We make funding decisions based off community indicators and input directly from the community. But we also know that to solve issues, to look at system change and cut through red tape, we need everyone that impacts children on the same page. In our community, we have an entity called the Roundtable. Funded partly through membership dues, the Roundtable consists of every entity in our community that either has an impact on children through either systems and/or funding, consisting of over 30 executive level members. And yes, the CEO has to sit on the table, has to sit at the Roundtable. The Roundtable includes the school superintendent, the United Way, the Department of Health, Children and Families, Early Learning Coalition, the CBC, the mayor of our city, the county commissioner, housing authority, police, fire chief, sheriffs, and that's just to name a few. There's 30 of them all together. We meet monthly to discuss community issues and how to solve them together. Additionally, we develop a strategic plan to address our community's most critical needs. I cannot stress how important it is to have everyone, and I mean everyone, singing from the same choir sheet. Some examples we've addressed together in the past have been our HIV/AIDS crisis, teen pregnancy, infant mortality, dental health, and what we're going to talk about here today, gang violence. As a funder, it is so valuable to have everyone on the same page in the same room, not only to address needs, but quite frankly, also to leverage funding. So with that introduction, let me turn it over to my good friend, my community partner, my sister from another mister, and the CEO of the Roundtable, Teresa Bishop.
Well, thank you so much, Sean, for that. And yes, I joke and say he's my brother by another mother. So we work very closely, and I think it's very important to have a Children's Services Council that's strong, that recognizes the need to support community efforts and really listens to the community. So the Roundtable, we provide the opportunity to hear from the community and identify priorities that we want to work on. Having said that, I want to go ahead on and get started because we have a lot to cover in a short amount of time. We're going to feature the Roundtable. We're going to feature Ignite Youth Alliance, which is our gang prevention program that we have that is partly funded by the Children's Services Council, but their money also, we've been able to leverage other funding. We'll talk about that in just a sec, but we also been funded by the Justice Department. And we want to share with you what the prevention strategy is still going on, and what that looks like and what our accomplishments look like. So next slide, I guess. So next, it's important to know that here at the Roundtable, we use data to make the decisions about the things that we want to work on. We utilize Dr. Hawkins and Dr. Catalano's Communities That Care model, which is what you see in front of the screen, which is the risk and protective factor framework. And in that, we prioritize a number of risk factors for us to work on, and you can see those that are in red that are key risk factors that we're taking a look at. And coincidentally, those are also risk factors that are predictors of violence in our community. And so what we needed to do was look at how do we address violence utilizing this, this framework, which is how we came across the gang prevention strategy that was funded by the Justice Department. Next slide, please. And so we've implemented the evidence-based practice of the comprehensive gang model here in St. Lucie County. In 2013, 2014, we were at a fever pitch in terms of gang violence that was happening in our community. And there was an outcry for us to do something. And so here we don't work on just direct services, although it's part of the, it's inherent in the comprehensive gang model. However, there are 5 clear components, and I'm going to unpack those shortly, but I'm going to give you a brief definition of each, going clockwise, starting at the very top. The evidence says that in order for you to quash gang violence in your community, you have to mobilize the community. And so community mobilization, we're talking in terms of grassroots as well as grass tops that are involved in the intervention process. The second component that's at about, I guess, 2 o'clock is social intervention. And this is where we get in there and we work closely with these young people that are involved in gangs, and we're not working with, and I have to say, low-hanging fruit. We're actually identifying key kids that are involved in gangs that are wreaking havoc in the street, to begin working with them and intervening in social environments and providing them other things for them to do and to be able to show them a different lifestyle. It's more than the notion, as you would imagine. And then we all, of course, there is the opportunities provision, which is where we look at other different types of opportunities that some of our young people have not been afforded. I saw someone put a note that we see how many kids are suspended. A lot of these young people started getting suspended in the kindergarten, 1st and 2nd grade. And so we have to get them back in the school and create other opportunities for them. The 4th component is suppression. We're talking not only law enforcement suppression, but there's also a key component around informal suppression. But we work very closely with our law enforcement as it relates to suppressing those most serious violent offenders in our community. We identify those who are wreaking havoc, and we will talk about what we do in terms of monitoring them quite briefly. And then finally, we have organizational change and development. What's so key about this work for prevention is that when we're working with these young folk, we find that many of these kids that are involved in gangs have suffered trauma, have other challenges that are going on. They have learning disabilities. They need a lot of other support. And so there may be some need for policy change. There may be some other practices we need to put in place specifically to serve this population, and that's key. It's not only key just for us to work with the kids that are involved with gang violence, but it's also key as it relates to looking at what other things that we need to put in to prevent other kids from ending up in gangs that are on the same trajectory. Next slide, please. So what I'm going to do now is I'm going to unpack our key accomplishment in those 5 components. First, in community mobilization, Sean didn't know I was going to shoot a picture of him in there. I dropped that in there. But we work very closely with our partners in that picture. You'll see Sean, our Department of Health chief, the mayor, and our 2 chiefs of police. All of these are our board members, but also they are key and involved with the gang strategy, comprehensive gang strategy. We've been able to leverage over $1.5 million to sustain the operations of the project. We were originally funded by the Justice Department for 3 years, and we had a no-cost extension, but then our community had to step up to fund it. And we have a number of agencies that have come to the table to fund it, but we're most proud of our public-private partnership because not only do we have federal funding, we've been able to leverage state funding. We also have local funding from, we just found out that our Boys and Girls Club is going to help fund some of the work that we're doing. And we also have private funding from a couple of foundations as well as private donors who are involved with supporting the sustainability of the project. And we had to have buy-in from key stakeholders. Next slide, please. The next part of community mobilization, next slide, please, would be that we have to also mobilize the grassroots community. So in the target area where the gang violence was involved, we had to get buy-in from local community residents, and we established the Lincoln Park Advisory Council. The Lincoln Park area is the target area where a lot of the gang violence is occurring. So you'll see, you know, Sister Green that's at the table and Sister Bradwell that's at the table. But also we have folks who work, live, and play in the Lincoln Park area who sit and talk about what are some of the key things that we need to know. I attend those meetings. I bring this information back to our executive committee so that they know some of the changes they need to address. Not only that, we bring our key leaders to that table as well so that we can start this cross-pollination between the community that we're serving and the grass tops. Next slide, please. Our next component is our social intervention. We've established a 13 agency intervention team. There are a number of players that are on that team, from Department of Juvenile Justice to the schools to other social service agencies. And every other week we sit down and we talk about very specific youth and triangulate what's going on with those youth to determine how can we mobilize them. Some of them need to be involved in other activities. Some of them need to be watched very closely by law enforcement. We have that conversation. And key, we also have a street outreach team. Our outreach team are made up of ex-gang members or folks who have been involved in the system already. We've been able to get level 2 background checks on them passed here recently, but they're 5 years removed from the work, at least in terms of being in the, on the streets. Now they're turning it around and they're like fathers, they're uncles in the community. They took them to Bethune-Cookman, but they take them to a number of things in the community and around the state to help them with the work. Okay, so next slide. So also with social intervention, these are some of our outcomes. We've been able to engage 150 gang members and their families and link them to a mentor, over 20,000 mentoring services. We also have been able to get 86% of the adult clients employed because they age out, but we keep them with us. They age out of being 18 years old, but they still are involved in gang violence. They usually start aging out earlier in their early 20s. So we hold on to them and provide support until they're on their own. 95% of school-age youth are re-enrolled back in school. So this is a great partnership for us to be able to do that. And overall, 80% of the youth do not reoffend after 6 to 12 months in the program. Next slide, please. We also, in terms of opportunities provision, had to partner with other partners. One with the Board of County Commissioners, transportation for some of the gang-involved youth who can't ride buses because of beefs that are going on, but they still need to go to school. So we are able to provide transportation for them. We also are able to, be able to work with summer employment with Career Source. And here recently in the summer, we offered a summer camp in collaboration with CSC, the Boys and Girls Club, St. Lucie Public Schools, to get credit for these young people and also to get employment for them as part of their work in the summer. We implement evidence-based program. We can, if you have more questions about that, but for the interest of time, we do like anger replacement therapy. We also have our program for our fatherhood initiative as well, because a number of our young men are becoming fathers and it's important. And 77% of our youth have participated in pro-social activities. Next slide, please. The organizational change and development, which is really big, is that we've trained our social services agencies and how to better serve gang-involved youth, because some folks don't know how to work with this population, particularly these kids who've been involved with trauma. They misinterpret their behavior, and sometimes these kids end up getting suspended where they actually need a lot more support because of behavioral health issues and other issues that are going on. We've been granted special access to schools and the detention centers. Sometimes we have to quash beefs in school. They'll call us to say, hey, there's some groups on the set in the lunch hour that we need your outreach workers out here to kind of work with these young people to find out what's going on. And finally, the Keeping Families Together protocol, which is really, we call it the lockout protocol. Some of these kids are discharged from DJJ, and the parents say, we're not taking them. But we had 17 agencies that have worked together to develop what do you do when that happens? And how do you work to reattach that child back to home? How do you get supports to the parents so that they can work with this youth that they typically had challenges working with? Next slide, please. And then in our suppression, we've identified over 500 documented gang members. We have mediated over 188 beefs. It's actually more than that now. We've experienced a 22% reduction in recidivism. And our juvenile arrests that we work with our Fort Pierce Police Department and St. Lucie County Sheriff's Office, we have 44 high-risk kids that we know that are toting guns that, you know, we need to keep an eye on, that they do jam checks on a regular basis. Next slide, please. So here is our output, our outcomes, if you will. While the population increased by 7% since 2014 that we began implementation, violent crime has reduced by 17.8% in St. Lucie County between 2014 and 2018. And in the target area, we've had a 70% decrease in crime in the target area between 2014 and our newest data is coming out 2018, and it's still staying the same. Murders have decreased, robberies have decreased. Yes, 70% is high. I see you, Virginia. It is, but it takes all of this to do the work. Aggravated assaults have decreased. And important, the perception in the community has changed. It's clear that a number of the folks are feeling safer in the community, and that's some of the work we've done. Next slide, please. And drum roll, please. 2014, we were ranked 64 in the most, out of 100 in the most dangerous cities. We were in there with Camden, New Jersey, and Memphis, and some of these others, top 100. We are now no longer on the top 100 list. Last slide, please. We better together. It's going to take collaboration, working with, and if you establish a Children's Services Council that's proactive, like the one we have, Sean Boyle is just really our go-to person. Whenever we have other needs in the community, we can go to him, and he also can drive funding to some of the other organizations based on some of the risk factors that we're identifying and that are plaguing our young people. So we're really excited about the efforts that we're doing, and we're continuing to expand. We're now serving girls because we found out that we just did a survey last year that the girls were, in fact, driving some of the gang violence as well. So we've got 2 female outreach workers. In fact, I got to interview another one this afternoon at 3 o'clock.